one of the core problems we have as it relates to healthcare is that healthcare starts from the wrong place. I'm a physician, so I can slam us, okay? We start with the chief complaint, we start with what's the matter, and we miss what actually really matters. So I'd like to share very briefly a story that illustrates this and then tell you what we're doing to change this. The story I'd like to share is of a gentleman, a veteran who was a patient in the Dallas VA who committed suicide. The gentleman had excellent health care in the VA, how his primary care team was completely devastated. They didn't see this coming. They talked to the family, and the family said he was suffering. He was really, really struggling. And the healthcare team didn't have a clue, and it's not because they didn't care. Caring, compassionate people, but they were doing the job that healthcare was designed to do. They managed his blood pressure perfectly, his diabetes was under control, they did all the clinical reminders, and they missed his suffering. We have to change this. We have to change what we're actually asking. What is healthcare for, and how do we redesign it so that we no longer miss people's suffering? The VA is radically redesigning the actual delivery care system, and there's 3 elements. The clinical care is still there, but I like to say it's a piece of healthcare in this system, not the centerpiece. In addition to the clinical piece, we have a huge effort, we call it the pathway, with peers who are trained nationally, and they're trained in the 5 signs. They're trained nationally at every VA facility to explore with veterans and their family members or significant others their sense of mission, aspiration, and purpose, and what they want their health for. Because that conversation is done way better in the community and with peers than in a clinical setting. So that's the first realm. The second realm is actually well-being programs, because once these veterans have a sense of meaning and purpose and they're motivated, they need to learn new skills. They need to manage their stress differently. They need to address nutrition and how they move, and meditation and mind-body approaches. So they need the skill building and support. So it's the peers, the well-being programs, and clinical care that now starts from a different place. It starts from that person's sense of mission, aspiration, and purpose, and it's all coordinated through a personal health plan. We're seeing in every VA that's doing this is the themes are 2. One is hope. Veteran after veteran says, I have hope again. And the other is connection, feeling connected in a community with others. And so that's what we're up to, and we hope to have that model the future of healthcare for the nation.